A 70-year-old female with a history of atrial fibrillation presents with irregular narrow complex tachycardia at 130 beats per minute. She is stable and asymptomatic. What is the best management option? A synchronized cardioversion. B. Procainamide. C. Beta blockers. D. Amiodarone. The correct answer is option C. During the resuscitation, the patient's heart rate suddenly increases to 180 bpm with a narrow QRS complex. What is the most likely diagnosis? A. Supraventricular tachycardia. B. Ventricular tachycardia. C. Atrial fibrillation. D. Atrial flutter. The correct answer is option A. Elective surgery patient codes VFPE post-induction, propofol recent, echo no wall motion, labs normal, BP was 110/70 pre. Toxins differential. A. Sodium bicarb 2 EQ/kg. B. Insulin euglycemia 1 unit/kg per hour. C. Intralipid 1.5 ml/kg. D. Flumazenil 0.2 mg titrate. The correct answer is option C. A 72-year-old man with a history of heart failure is found unresponsive. The ECG shows a wide complex rhythm with no pulse. What is the most appropriate immediate treatment? A. Administer adenosine. B. Perform CPR. C. Administer diltiazem. D. Prepare for intubation. The correct answer is option B.